Rabies, the deadliest killer. 4.5 million people are bitten by dogs every year. 40 to 60% of all animal bite cases are reported to occur in children less than 15 years of age. The causative agent of rabies is the lysoviruses of the Rabidoviridae family. The virus is transmitted by infected saliva through a bite, and it spreads to the brain as quickly as possible. From the site of the initial wound, the virus replicates in the striated muscle cells or connective tissue and enters the peripheral nerves through the neuromuscular junction. The virus finds its way along the nerve pathways to the spinal cord and the brain via the endoneurium. The virus spreads to the rest of the body via peripheral nerves. Initially, a person may exhibit flu-like symptoms, problem in swallowing, hydrophobia, anxiety, hallucination. As per WHO recommendations, dog bite and immunization is classified as 3 categories. Category 1. Touching or feeding suspect animals, but skin is intact. Immunization is not recommended. Category 2. Contact to nibbling of uncovered skin, minor scratches or abrasions without bleeding. Immunization administers the vaccine immediately, RIG, in immune-compromised patients. Category 3. Contact to 1 or more bites, scratches, licks on broken skin, immunization vaccine, plus RIG. Recommended post-exposure prophylaxis in exposed individuals. After being bitten immediately, cleansing of all wounds with soap and running water. After that, cleanse the wound with providine iodine or with any disinfectant. RIG and first dose of the vaccine should be administered. Each RIG should be administered in and around the wound. Remaining RIG should be administered by deep intramuscular injection at a site distant from vaccine injection site. Rabies vaccine should be given intramuscular 0th day, 3rd day, 7th day, 14th day, and then 28th day. Bharat Serums and Vaccines Limited, caring and trustworthy partner in bringing life to life, presents Berirab P, which is human rabies immunoglobulin, available in pre-filled syringe with dose of 20 IU per kilogram body weight. Active immunity. Anti-rabies vaccine. Administration of ARV stimulates production of neutralizing antibodies by the patient's immune system. Protective levels of antibodies are seen 7 to 14 days after the initial dose of vaccine. Vaccine alone results in treatment failure. Thus, the patients are vulnerable to develop rabies during this window period of 7 to 14 days, despite the timely and full course of any rabies is given. For complete protection, passive immunization with Berirab P and vaccine is must. Passive immunization. Berirab P provides immediate passive immunity in the form of ready-made anti-rabies. Antibodies results in neutralizing the virus, as incubation period of rabies virus is as short as 3 days. Berirab P infiltration procedure. After cleansing the wounds thoroughly with soap, water, and providine iodine, administer a pre-filled syringe containing Berirab P is ready for use solution and should be administered at body temperature. RIG should be infiltrated in and around the wounds. The RIG should be injected into the edges and base of wounds till traces of RIG oozes out. Sometimes, significant quantity of RIG may ooze out of the wounds. In such cases, this quantity of RIG should be replaced by fresh infiltration using an equivalent volume of RIG. Berirab P benefits. Provides rapid immune protection. International quality from CSL Behring. World's largest plasma fractionators. No skin sensitivity test required prior treatment. Ready-to-use solution for injection. Highly potent with ensured cold chain maintenance. Relatively free from side effects encountered in heterologous origin. National Center for Disease Control (NCDC) and WHO guidelines regarding protection against rabies should be observed.